The first one is group task. What is the definition of group task? Group task is some goals that we have to achieve by teamwork. Each member play their own roles and responsibility in process of creating positive healthy outcome. So who involved in group tasks? The doctor, pharmacist, nurses and patient. Next, the advantage from group tasks is improve quality of patient care. As we work in groups, so the outcome will be more efficient. Thus, patient no need to stay at the hospital for a long time. For example, is orthopedic unit cooperate with nurses to get patient medical background to ensure patient get the optimal treatment.
So next is self-awareness. What is the definition of self-awareness is the ability to focus on yourself and how your action, your thoughts or emotion do or don't align with your internal standards. Who involved in self-awareness is patient, nurses and also the doctors. The advantages of self-awareness is giving awareness to patients to take care of their health better and reducing the number of patients admitted to the hospital. Example is managing patients with diabetes, which is like the nurses must give information or awareness to the patient who actually have diabetes disease.
Group therapy is a therapeutic method that takes advantage of support group composed of people who share common situation or disorder. The group meet regularly and discusses their personal experience in dealing with their disorder and share ideas and insight on how to get better. Then, group therapy has no direct physical benefit. It focuses on providing emotional support to all members of the group. Who involved in group therapy is psychologists, therapists, psychiatrists, nurse, social worker, and client. Advantage of group therapy is group therapy help individuals develop communication and socialization skills and allow clients to learn how to express their problem and accept criticism from others. Group therapy allows individuals to develop self-knowledge by listening to others with similar problems, and it is a safe place for people to share their feelings and explore the nature of their mental illness. For example, group meet in a quiet room with a chair in a circle so that group members can see each other. At the beginning of the session, group members introduce themselves and share their reason for participating in group therapy. They may also talk about their progress and any obstacle or setback they have experienced in the last session. The exact activity in group therapy sessions vary from group to group. However, they usually focus on promoting open, honest communication and building trust between group members and their psychologists.
Body image refers to how we think and feel about our physical appearance as well as how we believe others perceive us. When we talk about body image, we can think about our bodies and how we look. Like we know, body image have 4 types, which is first, perceptual. Perceptual is mean how you view yourself, like how you feel about yourself. Second, affective. Affective is mean how you feel about your appearance. There are aspects of a person's appearance that they may appreciate. The third is cognitive. Cognitive is mean your body's thoughts and beliefs. Some people assume that if they lose weight, they will feel better about themselves. But other people assume that gaining muscle will improve their appearance. Your cognitive body image is the way you think about your body. And the last type is behavioral. Behavioral is mean your action in regard to your appearance. Why body image is important? It is because body image is significant because how we see ourselves affect all areas of our life, including our mental and physical health. A person who has healthy body sees their body objectively without distortion.
The second one is self-esteem. The definition is an individual's subjective evaluation of their own worth. Self-esteem encompasses beliefs about oneself as well as emotional state such as triumph, despair, pride, and shame. Self-esteem is an objective psychological construct because it predicts certain outcomes such as academic achievement, happiness, satisfaction in marriage and relationship, and criminal behavior. In other words, self-esteem can refer to self-worth, self-regard, self-respect, and self-integrity. The importance of self-esteem is it allows people to face life with more confidence, benevolence, and optimism and thus easily reach their goals and self-actualize. Important self-esteem in nurses profession is every nurses must to take care of their self-esteem to make sure the patient is comfortable, a safe work environment can be built, and highly regarded and respected.
Personal identity refers to those aspects of self-definition at the individual level, including goals, values, beliefs, and a whole set of associated self-representation and self-evolution. The definition of personal identity is the concept you develop about yourself that evolves over the course of your life. This may include aspects of your life that you have no control over, such as where you grow up or the color of your skin, as well as choices you make in life, such as how you spend your time and what you believe. You demonstrate portion of your personal identity outwardly through what you wear and how you interact with other people. You may also keep some elements of your personal identity to yourself, even when these parts of yourself are very important. So, maintaining self-identity is important because it strengthens your character. That is, when we know who we are, have confidence in ourselves, and are able to identify our strengths, we emerge as stronger individuals. Besides that, it keeps us unique and distinguishes us from everyone else.
The last one is role performance. The definition is the way in which individuals perceive their ability to carry out significant roles. Normal change associated with maturation result in change in role performance. The importance of role performance is teach us to always take care of our manners and be a good example to others. The example of role performance is sister and nurse is two different roles. When you are the old sister to your sibling, you might be angry with them, but when you are the nurse at the hospital, you cannot bring your role as the sister at the hospital when you treat the patient. You must be a professional nurses.
So the next one is teamwork. What is teamwork? Teamwork defines two or more people who interact interdependently with a common purpose. They working toward measurable goals that give benefit to them. Besides, the leadership must maintain stability while encouraging honest discussion and problem solving. So, what is the characteristic must have in teamwork? The first one is excellent communication skill. They will able to communicate in a clear and efficient way, so they can reach common purpose efficiently. The next one is have problem solving skill. Every member have to see a problem as an opportunity to improve patient well-being, not see as an obstacle.
There are four elements of teamwork. The first one is communication. In healthcare settings, messages that are far more important are passed between team members or between staff and patients or their relatives without checks. Checking that the message we send or receive are understood is vital, particularly when working with staff we do not know, such as agency nurse. The second one is situational awareness. Situational awareness is defined as an accurate awareness or understanding of the situation in which the team is functioning. A key to good teamwork is sharing one's perception, which is mental models we call it regularly throughout a shift. And the third one is leadership. If you are the team leader, you can create a positive culture by telling your team you want them to raise any concerns and ask any question they may have, however trivial, without fear. And the last one is mutual support. Mutual support is key in effective teams. People support each other. Everyone in the team needs to look after everyone else and watch out for signs of stress and overload in their college. And there are three strategies to build a successful team. The first one is encourage growth. encourage a grateful mindset. The second one is make it a habit to provide and receive constructive feedback. And the last one is create opportunities for team members to find things in common.
Advantage of teamwork. Firstly, we can improve clinical performance. Then we can build work cohesion and reduce error in medicine and nursing. Then we can provide certification and comfort to the patient. Then we can reduce fatigue among employers. Then we can reduce mortality rate among patients. And lastly, we can reduce stress in nursing circle.